My name is Nicole Macias. I'm going to talk about home use of an artificial beta cell in type 1 diabetes. Home use of an artificial beta cell in type 1 diabetes. The artificial beta cell or closed-loop insulin delivery system expands on the concept of sensor-responsive insulin delivery. The closed-loop system differs from conventional pump therapy and there's also spent approaches and that uses control algorithm that autonomously and continuously increases and decreases the subcutaneous delivery of insulin on the basis of real-time sensor glucose levels. Some investigations have shown improved glucose control and reduced risk of hypoglycemia. The application in medicine. The artificial beta cell uses a control algorithm to independently monitor and increase or decrease insulin delivery based on real-time sensoring of glucose levels. In contrast, insulin pumps that link insulin delivery to sensors that continuously monitor glucose level can only temporarily suspend insulin delivery based on preset glucose thresholds. This system can decrease the risk of hypoglycemia but cannot respond to hyperglycemia. The consistent glucose values were observed with closed-loop system than with the control therapy, despite high day-to-day variety in insulin requirements. So the pros and the cons. The advantage of a closed-loop system is a responsive graduated modulation of insulin delivery, but below and above the present pump regimen, which allows for improvements in the proportion of time spent in target glucose range or lowering of a mean glucose level without increasing the risk of hypoglycemia. It would be very useful for patients while they sleep or play sports and proves useful for home use. The cons. 3 severe episodes of hypoglycemia happened with the artificial beta cell, all when the system was not in use because of low battery or the system was not turned on. Artificial beta cell technology is fairly new and flexible. Safety and efficacy is prolonged use in the home setting have not been well established. So it should apply in Ecuador. Diabetes is an increasingly common disease in Ecuador, for there are two types, type 1 and type 2. Type 1 affects more children and young people, and it is linked to a genetic factor that develops at an early age, and type 2 is most common in the country or affects most adults. Of 100 diabetics in Ecuador, 2% are type 1 and type 2 are 98%. The type 1 is prediabetes, which is reversible and controllable, but if not detected and treated in time, it becomes reversible diabetes. And the blood glucose exceeds 126, it confirmed diabetes, which is treated with oral medication and insulin. The most used in treatment of type 1 diabetes is insulin. The insulin pumps are usually used in our country, but in a lower percentage because their implementation and maintenance is economically high. Yeah. So here's another video of a lady talking about the insulin.